What's happening, YouTube? Wayne is here. I am back. It's been a minute. It's been a hot minute since my last video. I've been crazy at work, working a lot of extra shifts, and between multiple jobs, been keeping me pretty busy, and I haven't really had time to make any videos or stream or anything like that. So I'm here today to kind of address some things. I think everybody is aware of the coronavirus disease that has plagued our entire world in the last 3 months or so. It's finally hitting home here for me. I live in northern Illinois, which has some reported cases a little bit south of me, but it's around. They think it's community based at this point, so anybody and anywhere can have it. Kind of some scary times we live in, and I know everybody's making videos about how they're going to document this and document that, but I want to document things too. I normally don't talk about my personal life on the internet too much. What I do for work is I'm a fireman. I'm a fireman for a couple different towns. That's why I'm busy. I work a 24-hour shift and I have 48 hours off, and in my spare time I work at a couple other fire departments just because normally I have a lot of free time on my hands, but lately it's just been crazy everywhere. So I'm going to start documenting when I can my life and how this corona disease, COVID-19, is spreading and changing my life. We're going to consider this day one, even though a lot of things have happened already to bring me to this point, but we're just going to consider this day one of the COVID-19 vlog. So far at this point where I live, all the restaurants and bars are closed. The only way you can get food from a bar or a restaurant is if they have drive-through. Schools are closed for at least the next 3 weeks. I have a feeling it's going to be extended, personally. We haven't been told anything. Specifically, it's just my personal belief is that I think it's going to end up going a couple more weeks, longer than they planned for. I've been in the fire service for a long time. I've been doing this since 2002. You could never do this nowadays, but I was hired in the fire service in 2002. I was actually still in high school. There was a program to where they would hire you on at age 17 with parents' permission, and they would put you through every fireman gets training, right? But they would just start you in kind of a slower process and do a lot of in-house stuff. You couldn't go to calls or anything like that, and if you did, you had to have somebody to kind of shadow and supervise you. And then once I turned 18 and I graduated high school, I was able to go to firefighter school, then subsequently went to EMT school, went to paramedic school, and all the other certifications that I have now. So like I said, I've been doing this for 18 years, and we have never had to deal with anything like this before. We are doing things now that we have never been told to do before. There was always safety measures like, if there's any bodily fluid, you should wear a mask and wear eye goggles and wear gowns. But in reality, the gowns really weren't worn that much. It would have to be a really crazy and just fluid-filled call for a fireman. For at least in our area here, I can't speak for the entire country, but at least for the area where I am from, to have to wear those gowns, it would have to be pretty nasty of a deal. Any more of like a serious call, you wear your safety goggles and stuff. But a mask, you'd never wear a mask. I hate to say these things and kind of like break the lid off stuff in the fire service, but it's the truth. Every fireman knows, and they'd be lying to you if they said that's not the way they did things. So, like I said, this is going to be day one. As of right now, as far as I know, I haven't personally been on any calls with a confirmed COVID-19 case. I'm sure that if something does come up, we would be notified, I'd like to think. So far as I know, I have not been even exposed to it other than the possibility of it being community-based, just being out in the community and shopping and whatnot. Like the rest of you, there's no supplies anywhere. There's no food in the grocery stores. If I run out of toilet paper, I'm screwed. But as of right now, I'm okay. I got some rolls. And I got some paper towels. So yeah, it's just going to be, we're going to go day by day. This is day one. I'm hoping to do another video tomorrow. Maybe, maybe not. And hopefully, if I have time, I'm still going to stream, and I'm still going to be putting out my gaming videos. So what we are going to do now, so now we are at the CDC website, taking a peek, see what they have to say. Since this is day one, we're going to kind of go through just some basics here on what you can do to keep yourself safe, okay? Steps to prevent the illness. You got to know how it spreads. Basically, there's no vaccine, and the best way to prevent it is to avoid being exposed. However, I do know that there are a lot of people that are stuck working, whether it be in the food service industry, at the grocery store, or even other factories that don't want to close down for whatever reason right now. Some people are still having to interact with other people, and we're not on complete lockdown yet. Basically, you need to stay about 6 feet from each other, and just, if someone coughs or sneezes, hopefully they cover it real well. That's all you can do. Ways to take care of yourself. Clean your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you've been in public or after blowing your nose, coughing, or sneezing. Reason being for that, obviously if you're out in public and you're touching things, you could get the bacteria or virus on your hands, and it's just best to get that stuff off as soon as possible. And the reason you want to wash your hands after blowing your nose, coughing, or sneezing is because you might have the virus and not know about it, and you don't want to transfer that on to anybody else, so you want to get that off your hands. Even though this virus is highly contagious with just breathing and sneezing and everything else, you want to take all the measures you can to protect yourself and to protect your neighbor. If you're not able to wash your hands, use a hand sanitizer with at least 60% alcohol. Cover all surface of your hands and rub them together until they feel dry. Basically, you want to get it in your hands, wipe them together like this all the way around, get in between your fingers, get your nail beds, get your thumbs, all that stuff, and then you're good to go. Same thing with soap. Do that same thing with soap. I don't want to say that as the CDC recommended way to wash your hands. There's tons of video on YouTube of the proper hand washing techniques. If you're that concerned about washing your hands, go check it out. You should really scrub your hands with soap and water, or that alcohol if there is no soap and water, for about 20 to 30 seconds, okay? That's the best way to do it. And lastly, avoid touching your eyes, nose, and mouth with your unwashed hands. So you don't realize how hard this is until you actually try to start practicing it and doing it on your own. But lately I've been doing it, it's like we're almost in the springtime here. It's warm enough to almost be springtime. With my allergies kicking in, like my eyes get a little itchy. So it's been really hard for me these last couple of days here. So I've really been making sure I keep my hands clean at all times, so I can wipe my eyes if I need to. Yeah, I should probably take like a seasonal allergy medicine for that, but I don't. Anyways, next up, you need to avoid close contact with people who are sick. Put a distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting very sick. So the people who are at high risk of getting sick are like the elderly, right? Let's see what the exact thing is. So older adults. So basically the elderly. This could be your parents in some situations. This could be obviously your grandma and grandpa in some situations. This could be an older friend you have. If you're old, you're at high risk. If you have any symptoms, you need to contact your doctor immediately, okay? But if you notice you have a fever or a slight cough, call your doctor and get direction from them. If you're having a really hard time with things, whatever your illness may be, and it seems serious, go ahead and call that ambulance. Call 911, okay? I'll be more than happy to come out and help you. People who have a serious chronic medical conditions also are at very high risk. That is heart disease, diabetes, and lung disease. So this is America, folks. Let's not sugarcoat things here. There's a lot of obesity in America, and there's probably a lot of undiagnosed diabetes in America. Those people are really at risk. If you have some friends, family, whatever, they're a little overweight, just just check up on them, make sure they're doing okay. And also, your older parents, friends, your grandparents, check up on them too, okay? Take steps to protect others. This is huge. This is huge right now. We're at a time now where there could possibly be a lot of people who haven't been tested, who are out in public. So the biggest thing that you guys can do right now is to help protect not only yourself, but maybe your significant other, your close friends and families, and your neighbors as well, and the people you just run into on an everyday basis. This is the time when we're most vulnerable, and we need to take precautions, okay? If you guys are sick, you need to stay home. I know it's hard for a lot of people. You get into financial troubles if you stay home. I mean, everybody needs a paycheck, right? Get that. If you're an hourly worker, it's tough. I understand. But you need to stay home. And I would like to think your employer would give you some leeway right now. If they don't, I'm sorry to hear that. That's terrible. You really got to stay home if you're sick. What are you going to do if you are sick? You are going to call your doctor if you think you have been exposed to COVID-19 and develop a fever and symptoms such as cough or difficulty breathing. Call your healthcare provider for medical advice. Okay? I do want to stress that, let's say you do have a fever and then you get a cough, right? And you're having a really hard time breathing, and you're really gasping, really needing some help. Please, please, please just call 911 and let the paramedics come help you. But if you just feel like you're sick and you have a fever and maybe a cough and a sore throat, call your doctor, stay home, okay? So let's see here. Steps to prevent spread if you are sick. Stay home. People who are mildly ill with COVID-19 are able to isolate at home during their illness. You should restrict activities outside your home except for getting medical care. Avoid public areas. Do not go to work, do not go to school, and do not go to any public areas, okay? Also, this is also very important, avoid public transportation. Avoid using public transportation, ride sharing, or taxis. So that's no school buses, which is school shut down, so we don't have to worry about that. But like, if you live in the city, don't get on those CTA buses and go flying around in those, because you're just spreading it to everybody that's around you. Ubers. I know you got to get around somehow. Maybe ride sharing is your only way. But like an Uber, try not to if you don't have to. It's terrible. You don't want to get the driver sick. And taxis, obviously, in the city and even in some of the local areas where there's some taxi services, just try to help those guys out, okay? They don't want to get sick either. And they're very susceptible with everybody else that got to drive around. Separate yourself from other people and animals in your home. Stay away from others as much as possible. You should stay in a specific room and away from other people in your home. You should use a separate bathroom if available. So yeah, my plan is if I get it, I'm going to hunker down right here in this room. Right now, I got a dog bed in here for my dog, but if things get rough, we're going to throw some blankets and some pillows down, and I'm going to hunker down in here. And all I need is my computer, and I'll be golden. I'll be okay. Next up, you need to limit contact with pets and animals. You should restrict contact with pets and other animals while you are sick with COVID-19, just like you would around other people. Although there have not been reports of pets or other animals becoming sick with COVID-19, it is still recommended that people sick with COVID-19 limit contact with animals until more information is known about the virus. Just for example, right? You cough, you're at home, you cough, you wash your hands, and you do a good job washing your hands, right? It doesn't guarantee you're going to get everything off, unfortunately. That's just the way it is. So then you go and pet your dog, right? You go and pet your dog, and you make them feel better. You pet the dog, and they're making you feel good. And then your dog leaves you, right? Your dog leaves you and goes downstairs to your significant other, or family member that you're living with, or roommate, or whatever. And boom, your roommate touches the dog, and now they have it on their hands, and then they wipe their nose, or they're eating with their hands, and all of a sudden, they're exposed. So be careful. Call ahead before visiting your doctor. Call ahead. If you have a medical appointment, call the healthcare provider and tell them that you have or may have COVID-19. This will help the healthcare provider's office take the steps to keep other people from getting infected or exposed. That's pretty big, man. You don't want to expose other people right now. So the biggest thing we can do is just make sure we are staying away and staying home and calling our doctors, okay? Wear a face mask if you are sick. If you are sick, you should wear a face mask when you are around other people. Example, sharing a room or a vehicle, or pets, and before you enter a healthcare provider's office. So if you can't drive yourself to the doctor and you need a ride share, or you need to have somebody else drive you, make sure you put a mask on, okay? At least a surgical mask. And I know masks are hard to come by right now. Whoever is sick should have a surgical mask on, right, to keep the dust and the virus from spreading out. through the air. Hopefully that'll catch some of it. And if possible, whoever you're with should really be in a surgical mask as well. Optimal situation would be them having their own N95 mask. But if all else fails, some people might have to use surgical masks. But basically, if you're sick, you need to have one on so you don't spread it to other people. If you are caring for others, if the person who is sick is not able to wear a face mask, for example, because it causes trouble breathing, then people who live with the person who is sick should not stay in the same room with them, or they should wear a face mask if they enter the room with the person who is sick. I think you guys are seeing a trend here. Like this disease is very it's highly contagious, and just being in the same room with somebody, whether they don't even have to cough or sneeze, just them talking and breathing is enough to pass it on. So just you guys really need to be careful. I just really want to stress to everybody that just being around people, you're going to infect other people, and it's just a snowball effect from that. And we're at a tough time right now. I think that's happening a lot. I think a lot more people are sick than we know. Cover your coughs and sneezes. Cover your mouth and nose with the tissue when you sneeze or cough. If you can't, you should try to maybe be like this, keep it closed, or go like this, keep it in your arm, and then, if you use a tissue, put it in the trash. Don't throw it into the trash. I know this says use tissues in the trash can, but take it to the trash can and set it in the trash can. You don't want to be throwing that stuff around, because when you throw it, it kind of spreads. I should say what I've seen on the internet from other people talking about it. Don't throw it into the trash. Just kind of dispose of it nicely. And as soon as you're done coughing or sneezing, make sure you wash your hands immediately for at least 20 seconds. Or if soap and water are not available, clean your hands with an alcohol-based sanitizer that contains at least 60% alcohol. Okay? Clean your hands often. Clean your hands often. Wash your hands. Use hand sanitizer, soap and water. Avoid touching your mouth and nose with unwashed hands. Avoid sharing personal household items. So we don't want to share dishes, drinking glasses, cups, eating utensils, towels, bedding with other people or pets. So, if you have to, let's say if like I get sick, for example, my wife, what I would do is I would let her use all the nice utensils and stuff, and I would ask her to nicely go to the store, and maybe procure some, paper plates and plastic silverware and stuff for me. I guess if you have to, if you have to use the same plates and dishes, silverware and stuff like that, just make sure you really wash them well after the fact, okay? Like really wash them. I would really like to suggest that you just separate things out, maybe get some disposable stuff for whoever's sick, maybe for everybody in the house, just to avoid the entire cross-contamination deal. Let's get disposable stuff. But if you have to, I guess just really make sure it's clean. Also, we want to make sure that we are cleaning high-touch surfaces every day. You don't realize how dirty things are until you really start to clean them. Like, I'm normally kind of a clean person in my house. I'm always walking around wiping stuff up. But recently, we've just been cleaning everything. And you're like, oh my gosh, how is this stuff so dirty? So it just goes to show you that, humans aren't as clean as we thought we were. And we just need to make sure we are doing that. We really want to make sure we clean surfaces that have a chance of having blood, stool, or bloody fluids or body fluids on them. So like bathrooms, toilets, the bathroom floor, bathtub, shower, whatever. We just really want to make sure that stuff is cleaned really well. Using a household cleaning spray or wipe according to the label instructions. Labels contains instructions for safe and effective use of the cleaning product, including precautions you should take when applying the product, such as wearing gloves and making sure you have a good ventilation during use of the product. So, for example, like let's say I'm going to use some kitchen cleaner, for example, to clean my kitchen counters. I'm going to look at the back of the label, and I'm going to see what it's on there. I want to make sure that it meets all the EPA specs, and most of the stuff has it states right on there that it'll take care of the human coronavirus. That's the kind of stuff you're looking for. So look on the back of your cleaning solutions or whatever, and then it'll also give you directions on how to use it. The specific cleaning stuff or the specific disinfecting stuff that I have in my house, I have to spray and let it sit there for 5 minutes before I wipe it up. And then I wipe it up, and then when I'm done wiping up all the spray and stuff, I have to come back with a little bit of soap and water just to kind of pick all that stuff up. So just make sure you are following the directions on the back of your household cleaner, okay? Next up, you need to monitor your symptoms. Seek medical attention if your illness is worsening, example, difficulty breathing. Like I said, if you're not really having that trouble breathing, call your doctor first. But if it's getting rough, by all means, call an ambulance. That's what they're there for. They'll come help you. Don't be surprised if they show up, wearing a mask, goggles, and a gown. Okay, they got to be safe. If they get sick, they can't help the next person who's sick, and they can't go home to their family, most likely. Okay, so just be aware of that. Wear a face mask when sick. Put a face mask on before you go out. Call your doctor before seeking all care, unless it's life or death, or you're having some really trouble breathing. Okay, and then once you do get to see the doctor or you get to the hospital, they should do this automatically for you, but just make sure you give them a heads up that, hey, you should probably give your local state and health department a phone call, all right? I really want to stress that you need to call 911 if you are having a medical emergency, okay? If you have a medical emergency and need to call 911, notify the dispatch personnel that you have or are being evaluated for COVID-19. If you have a face mask, put it on before the firemen arrive or the EMS workers arrive, okay? Don't lie on the phone to dispatch. That's the worst thing you could do for everybody that's coming to help you. The worst thing you can do is lie on the phone. Just be honest with them. Like, hey, I've had a fever for 3 days and I have a cough. I don't know. I might have COVID-19. It's better to be safe than sorry. And if you don't say anything, since personal protective equipment is such a shortage right now, if you say, no, I'm fine, the paramedics and firemen might come in and not be wearing the appropriate gear because they're trying to conserve it for when people do say, yes, they do have it. So if you have it, if you're having symptoms, please don't lie and tell the dispatchers, okay? Please. As far as discontinuing home isolation, stay at home until you've been told you can leave. Patients with confirmed COVID-19 should remain under home isolation precautions until the risk of secondary transmission to others is thought to be low. Talk to your healthcare provider. The decision to discontinue home isolation precautions should be made on a case-by-case basis in consultation with healthcare providers and state and local health departments. I can't stress that enough. If you are sick, do not go out. You need to stay home. The only thing you are going to do is if you go out, you're going to get other people sick. Like, it's not if I get other people sick. It is you will get other people sick. Stay the frick home. Just to go back on day one, I'm at my brother's house. He's getting some internet installed. So beyond the contact of the guys at work, it's just been my wife and this internet installer and my brother. The internet installer, I didn't touch him, didn't shake his hand, he just walked past me. I tried to stay in a different room, and my brother, he just walked past me as well, so we'll see. Thanks guys for watching. This was kind of a first video. I'm sure as the COVID-19 pandemic starts to ramp up in my area, these videos are going to get more and more interesting. I'm going to try to talk about as much as I can. I don't want to violate any laws. I don't want to violate any HIPAA laws. So I'm going to do what I can to keep you guys updated. And, hopefully, my personal goal is to not get sick. But you never know. And if I do get sick, I'm going to try to be here and keep you guys updated with this as well. Thanks for watching, guys. I do appreciate you sticking around. This is a little bit longer video than you're used to, and it has nothing to do with gaming, which is what I normally do. And yeah, I just want to say thank you in general. I appreciate it. Don't forget to subscribe to this video and click the bell down here. It's going to be